Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello, Roxy.
Hello.
We're back. And it's during the day.
As the sun is shining.
We are doing a little prepping with Roxy getting ready to have her baby. So I wasn't sure if we'd record today if she was in labor. Everybody just needs to get real excited for the episode after she has her baby. We'll find out if she's having a boy or a girl and how her labor went. All the good details.
Well, juice.
All the juicy details.
Or not.
Or not.
We'll see.
Oh. All right. Well, we have an episode today that we are diving into a topic called Lichen Sclerosus. It's a condition that affects the vulva, perianal area, and sometimes the penis. It's an underdiagnosed and often misunderstood, and it deeply impacts quality of life. If you've ever wondered why your vulva feels itchy, sore, or tears easily, or why intimacy has become painful, this episode is going to be for you. And also, when we talk about this, we will touch on there are many reasons for those symptoms, and it does not mean that you have lichen sclerosus. It's just a topic we figured that we see in the clinic, and it is misunderstood as far as sometimes it goes underdiagnosed, and then suddenly women realize what's going on, and there is some emotional components that can come with lichen sclerosus that women aren't prepared for. So we'll kind of talk a little bit about that. So Roxy, let's dive in. Let's tell us a little bit about what lichen sclerosus is.
Sure. So it's kind of just a big scary word, right? Lichen sclerosus. But basically, it's a chronic inflammatory disease that happens on the skin of the vulva. And a lot of times this is going to happen in postmenopausal women. Not always, though. Like we've both seen patients that it's not necessarily postmenopausal, but I think just, if we're really looking at like who struggles with this the most, then we can kind of generalize that, but it definitely can happen at any age.
I almost say I wonder if they, we kind of think that because when the first symptoms start happening when you're younger, it's like they really don't figure it out, something you just deal with. And then that's kind of when maybe it gets identified. So
Yeah. No, I know. I was just thinking about some of the cases I've had, and it's definitely not only that population, but I also wonder just with that big hormone shift, if that could, maybe bring it more,
kind of make it worse,
bring it to the surface for sure. Yeah. But it's immune mediated. I think also thinking about, the perimenopausal woman we've talked about like the mental health, and just that and the stress that goes with that season of life too. So I think that's kind of interesting. Just to kind of be curious about it. And so there's inflammatory pathways and auto antibodies. And so we're really looking at this. We're seeing it at the vulva, but we see that there's definitely a systemic component to it. And so basically the symptoms that we notice with this are, just imagine if you're irritated in your vulva, there's intense itching, burning. There can be tearing and just inflammation, irritation. There's one piece that really steps out with
distinct.
This. Distinct is there's these white patches that are kind of shiny. A lot of times the skin gets real thin and it just looks not healthy. And then sometimes, obviously, if it's been going on for a while, there can be scarring. And you can just see that the vulvar anatomy is different. It's changed. It's maybe atrophied a little bit. I kind of think of it as shrink, it kind of shrinks. It's not as plump and healthy.
Yeah. There's a fusion. We'll talk about it, I think, kind of down a little bit. But yeah, it's the labias can kind of absorb in almost like a fusion. So it's definitely some changes that can happen, but we'll talk more about that for sure.
Yeah. And kind of as we're just talking about these symptoms, just kind of an important side note is that it affects the skin. It's more of like the vulvar skin. It's not
Mhm.
necessarily inside the
Uh-huh.
vagina or the vaginal canal itself. And so pain with penetration can be from that skin on the outside narrowing and like some of the scars that could maybe happen. And then really probably what we see like in our world or what we're identifying the most is that because of that exterior skin irritation and bad sensation and pain, then the pelvic floor muscles tense and they
Mhm.
guard and they grip because the body's anticipating that. Remember, we've talked about treating the whole body here. The
Yep.
body is anticipating that pain, or it's like anticipating when you sit or when certain activities, it's anticipating that pain. So then we start to have this chronic gripping and guarding and the pelvic floor tone increases. Well, then that causes even more problems, more pelvic pain or pain with intimacy or just a lot of other hosts of problems. So from a mechanical standpoint, just understand that the diagnosis is vulvar skin focused, but the ripple effect
Yes.
of it
Right.
is more musculoskeletal.
Yeah, other things. Yeah, for sure. And with the intense itching, we're talking like people will report that like they'll itch so bad that they'll like itch in their sleep and they won't even know it. And they'll itch so hard that they have skin breakdown. Like that's like they get tears. And so the tearing can happen from itching. It could happen just from wiping. Like it could happen with sex really easily. And so these are just little things. But here's the thing, this is where it starts to get tricky. And we're going to talk about some of the differential diagnosis of this is also, sometimes those little tears and things can happen when you become perimenopausal or menopausal because of the hormone changes. So if you're listening to this and you're like, oh my gosh, I have this,
Yeah.
like don't think that you have LS just because you might have some itching and some irritation and some tearing. Because as someone who is myself, 41, going to turn 42 in November, I can tell you as you have estrogen changes vaginally, experience this myself, then you can sometimes notice those things as well. But talking about it's immune related, mediated, it also is something to think about. Like if you have other autoimmune diseases or autoimmune full body inflammatory responses, this is one of those things where if this does show up, it's like, okay, we need to be looking at like how yes, we're going to treat just this area, but then what are we looking at in the whole body? What's the whole body's inflammatory system doing? Because people with lichens can have almost like flares of it, and then it can kind of like back off and be fine, and they don't have any issues with it, and then it can come up again. And so it goes down this whole thing too of gut health and just different things that like sometimes we just see in the clinic, especially I've seen with different patients and how they've handled lichens. And it's just something to be aware of because also I have had patients that have these symptoms. It kind of gets brushed over from their provider, like, well, yeah, it might be lichens. Maybe they give them some clobetasol and don't really explain the whole process of what lichens is. And clobetasol is a topical steroid. We'll talk about that. So they give it to them. They don't really know how to properly use it or for how long. And so they don't. And then before they know it, like your clitoral hood can kind of like get stuck or fused because of the skin changes that happen. It can like reabsorb. And so then somebody's shocked and like they're like, if someone would have just told me that this could happen, you could be proactive in mobilizing your skin tissue. And so I think that's what I notice. And it kind of like it is a bit frustrating that like that women aren't educated enough on this because then they have some life-changing things happen. And if they were just educated better, then it could have been prevented. So anyway, so let's talk about what else it could be if you have these symptoms. When someone has like itching, burning, skin changes at the vulva, several conditions can mimic lichen sclerosus. So basic things like a chronic yeast infection, obviously you're going to have burning, itching, and redness, and it may, it's going to respond to the antifungals or like monostats unlike lichens will. So like if it's lichen sclerosus, it won't get better if you use those. Lichen planus is another inflammatory skin disorder that can involve the vagina as well as the vulva. I have never had anybody that has been diagnosed with this, so not as definitely, I mean, at least where we're at, not as common. So big one here, this is what we were just talking about, genitourinary syndrome of menopause. And that's the atrophic vaginitis. So just kind of the vulva and tissue gets just kind of like less plump and a little bit smaller and more reabsorbed. And so you have thinning of the skin, dryness, burning due to low estrogen, but without the white plaques and scarring of lichen. So the white plaques are kind of one of those key indicators for lichens. And so that is something that we just would want, you want to keep your eye on. Okay. And then, of course, there's things like eczema or contact dermatitis, irritation from soaps, pads, detergents, types of clothing, like that kind of stuff. You're not going to have any scarring. You change your soap, goes away. We shouldn't be using all that kind of stuff, too fragrant of things anyway. Psoriasis can affect vulvar skin with redness or silvery plaques, usually with history of it also being somewhere else in the body. So like if you have psoriasis really bad, I mean, that's just an option that we could notice it there. And then that's why we always kind of promote vulvar skin checks to just make sure that you're not noticing any sort of rapid change or like, tumor growth or anything like that. So just want to make sure that there's no like cancerous cells or anything like that. So here's your reminder, when you do your monthly breast exam, go ahead and get a mirror and look at your vulva also, because it really is important to make sure that we're not noticing like big changes happening. And so those are kind of just those differential diagnoses. And probably one of those main ones with the comparison is the genitourinary syndrome of menopause, and just knowing that the white patches of skin aren't there, but they can kind of act like each other. So, and the treatment is different, which we will talk about here in just a second. So tell us why it's important. Diagnosis matters.
Well, just like anything else in the body.
Yes.
Better if we just catch it right away, and nip it in the bud and prevent, further symptoms, whatnot. I mean, that's just kind of an obvious, but really what we don't want to happen and what will happen if we don't catch this and we don't just treat it, because it's just a pretty simple, I mean, it can be a really pretty simple treatment if we catch it right away, and that's easy. But then what happens if we don't is it can lead to then that scarring. Megan talked about that fusion of the tissue where like tissue gets kind of where there's natural folds right now, instead of that you being able to like peel your labia apart, they'll just fuse and absorb and disappear. And so like there won't be mobility down in that area. And then we'll see scarring too from some of that tearing. Then there can also be, when that happens, then instead of having good mobility, the vaginal canal then will narrow.
Yeah.
It can really narrow, like almost close if it's very severe. So obviously this is a progression, so don't panic.
Yeah.
If you're questioning,
it can also not happen.
Yeah. It's a progression. It's just kind of like anything else. Like if we just let it go,
yeah, if you don't pay attention,
it's going to get worse and worse and worse and worse.
Yeah.
And so that's where we really advocate for that, like that early diagnosis. That's where Megan just said, like, let's be looking at it. So if we see something from 1 month or 2 months different, then that's easy. And that's very doable. This isn't going to happen overnight. This is very like a progression, but that's just, it is important not to just be like, oh, it'll probably be okay. Like it's not going to just go away by itself. And so there's also a really small, and like we say this gently, again, not to breed fear in the minds of anybody listening, but there is a small but real risk of vulvar cancer over time. Now, this is like 2 to 6%. I mean, it's kind of with anything that we see is that there's like a small risk of cancer, but it is something just to take seriously, where it is so easily managed if we catch it. We just want to throw that in there though, just to have it be something that you're aware of. A lot of times when we catch it early, quality of life is like restored easily, and it's kind of not a thing. I mean, it just like, it's fine. But if not, then that quality of life can be significantly changed, because, I mean, honestly, if your like vaginal opening is narrowed and tiny, like intimacy is going to be impacted, just like there's so much there that just like quality of life is going to change. So we want to just be keeping an eye on this. We want to monitor it lifelong, since it is more like immune mediated. If someone's had it once before, it's like, let's keep that on the radar for sure. And then for anyone who's never had this, it's just like Megan said, like when we're checking doing our monthly breast exam, let's just like take a mirror down there too. And not out of fear, but just out of being a smart human and wanting to take care of our bodies and be in a wellness situation there. And so anyway, that's kind of just our quick hit on why this is important and why we're pushing this diagnosis when appropriate.
Yeah. Because I've had plenty of patients that have come in and they're like, oh yeah, diagnosed with lichens years ago. I haven't had any trouble with it for quite a while. And, it's like, great. We just keep our eye on it and make sure that we don't have any flares. So we're going to talk about kind of like first line treatment. The medical gold standard for first line treatment is super potent topical steroids. And the main one that we hear about is clobetasol ointment. And so there's typically it's used on a taper. So obviously you defer to what your doctor recommends, but typically it's something, it's like everyday thing and then like an every other day thing and then a couple times a week. And then you stay on that for maintenance. Then there's some things you have to keep in mind when you're using that. But there is a physician, Jill Kraft, I'm pretty sure. She's a great doctor that I believe, man, I don't want to misspeak. She was in Florida. I'm not sure if that's where she's at now. That this is one of the main things that she treats and kind of has a protocol for it. So, and I know that like they talk about there's the maintenance of using this. And so you have to watch out for like skin thinning and stuff like that. And then, yeah, it's like that's the maintenance piece is like crucial for prevent of relapse. So that's the thing is like this is something that like it can come up, it can be active, and like you want to get it to calm down and be kind of like autoimmune stuff. It flares, it quiets, same thing. But yeah, research shows that you want to be proactive with it. Estrogen or DHEA can help like genitourinary syndrome of menopause, but that doesn't treat lichen sclerosus itself. So if there is that like you could also have like two different things happening here. So that's something too that you and your doctor would discuss. There's other things that are out on the market now, lasers and different things. And this is all just still under investigation. So as far as like, we're not really sure. And current evidence shows they're not superior to the steroids. So that's just where we're at right now with this. So self-care tips is like fragrance free, any sort of barrier, ointment, anything like that. Avoid tight clothing, harsh soaps, like just as anything with our vulvar care, like just keep vulvar care in mind. We're just wanting to make sure like good hygiene, stay hydrated, like eat well, all of that kind of stuff. It does play a role in our vaginal health.
I think that just goes back to like, really thinking about Dr. Lean's conversation we had.
Yeah.
Just like, let's just create an environment of health that promotes health and decreases the chance or the prevalence of inflammation or irritation or dysfunction in general. I always think about that, especially when you were talking about like the estrogen and like GSM of just saying, yeah, let's just be taking care of our body as much as we can control it. And what's like the low hanging fruit there.
Yeah.
It's not going to solve the world's problems, but it also can prevent or it can decrease the inflammatory load or just the irritation load that our body has. And so that just kind of reminded me of that, of like the simple things to help that environment be healthy.
Yeah.
Whether that would prevent it or just keep it from flaring.
Yeah.
It's worth it. And you're going to benefit from it 100 other ways too.
Well, and also, to that point, I've had a couple of people where like they are having a hard time getting it under control and it's incredibly stressful. It's like maybe we're not sleeping well, we're super stressed about it. It doesn't feel good. And we know that this chronic override of the nervous system and stress can be a driver of inflammation also. Typically, if we can kind of get like a good plan, you feel well cared for, you feel safe in your plan, you feel heard, then we can start to slowly undo the fire that is literally burning to decrease all your symptoms and inflammation, stuff like that. So that's why it really is good to have a multidisciplinary team with something like this, because finding a pelvic health physical therapist or occupational therapist that is familiar with lichens could be really helpful after a diagnosis, just for pure education and prevention. Like Roxy said, I have had some patients where they come in and we're trying to get back to being able to have penetrative intercourse with less pain. And so we're having to use dilators and we're having to really move slow so that we can avoid the tearing and make sure we're stretching the tissue appropriately. And so that's all something that like, that's our specialty, and we want to be there to help support our OBGYNs and be there to support anybody like women's health nurse practitioners, functional or not. We're part of that team that can help on our end, just like they're there to help more on like the steroid side and medication side. And if there needs to be a biopsy done to confirm it. So that's my 2 cents.
Yeah, let's segue that then and just talk about like what we actually do as pelvic floor PTs and what our role is in that. And I'm just going to piggyback off what Megan just said, like just to be clear, we aren't treating necessarily the skin and the lichens itself. Like that is dermatology or gynecology. That's not our scope of practice to actually treat that piece of it. That being said, it very much is our scope of practice. And I think really a collaborative care is absolutely the best route you can take of having a pelvic floor therapist then to treat the consequences of that while we have a specialist that's managing that diagnosis itself. We hinted at this earlier, but that pelvic floor overactivity is a real thing. I would say every person that I've treated with lichen sclerosus has pelvic floor overactivity. There's guarding and there's increased tone, and it's due to the pain or the fear of even just like wiping, or people usually know the triggers. Therefore, when they're about to experience something that has historically caused more pain, their pelvic floor is going to guard and try to protect them per se from what's about to happen. And so we very much just see that increased muscle tone, and then that is a spiral effect. Basically, it just worsens the pain then, and then they guard harder, and we just kind of see this nasty cycle there of the pelvic floor muscles being tighter. Also, along with that, very common is what we call just dyspareunia. That's just a fancy word for pain with sex. And so we're treating that just like if someone has that without lichens, although we just have this consideration that we need to be very careful with the skin around there and keep an eye on that. But we're going to use obviously manual therapy. We're going to be working like the nervous system relaxation training. Megan hinted on like dilator programs to help just that tissue accommodate and be comfortable with stretch and expansion for that. And so that's one of the consequences that we treat. And we treat that whether someone has lichens or not, but we just keep a kind of an extra eye on the skin around there. And then this buddies up with that also, but just that introidal narrowing. When we say introitus or introidal, that's just the opening, like the vaginal opening there. And so we talked about how that can like really get smaller and absorb kind of in on itself. And so we just are real gentle with that, but we really want to help, especially as that skin kind of heals and we're restoring that health that we talked about earlier. We want to really help the skin accommodate to stretch again. It's kind of like working out. If you don't work out, your muscles aren't going to step up to the challenge, right? And that's kind of the same idea. If you can kind of imagine that of saying, if we don't then challenge that tissue to stretch and lengthen a little bit, it's not going to just probably do it on its own. And so that's where someone who's really skilled and knows how to help that tissue be restored as we're overcoming that lichens flare, then we want to be reestablishing better health in that tissue and teaching it then how to lengthen. And this then goes along too with the body then is going to be kind of nervous about that. So it's going to want to tighten up. And so being in someone's care that knows how to do that well is really important. We also then are going to talk about, as always, we do a ton of education with all of our patients, but especially with these people, we're really hitting on the education piece of like bowel and bladder tips. And so just different strategies, whether that's wiping or positioning for urination or preventing constipation. You know, if we're putting pressure down and that tissue has to stretch, the body's going to guard, and that's going to be a whole nother problem in and of itself. Sometimes too, things like just like using a peri bottle or, you know, having a bidet. Like these people do really good with those quick little bidets that just pop on the toilet, you know? And so just giving them ideas because they're in the weeds of not understanding what's going on and not knowing maybe some of the options or the resources that are available. And so just saying, here's some options other people that have dealt with this really benefit from. Take it or leave it, you know, kind of see what works here for your lifestyle. We're doing a lot of education with these people on how to do these things when they're in a flare, but then how to continue to kind of just keep that area healthy. Also with this is kind of like when Megan was talking about estrogen, you know, and just even the health of that tissue, kind of maintaining all of that. We're also chatting with the folks who are sexually active or wanting to be sexually active. We're doing a lot of education and coaching too around how to resume or how to like try to continue that if they still are. Really pushing, again, some education of like lubrication and helping them find a lubrication that's good for their skin. Maybe different positionings, maybe different just modifications and strategies, how to communicate with their partner. Sometimes when this has all been normal and fine, and then there's a wrench in that, even just knowing how to approach the other person and how to troubleshoot with them. I think there's just a lot then that goes into that, especially when people feel like, well, I have this diagnosis now and I'm broken and are things ever going to be the same? And there's just like, there's a lot that it's hard to then just deduce that down to saying, why don't you guys have a conversation, and giving them prompts and helping them navigate those conversations. We've just seen really good outcomes from those conversations between partners. Anything else, Megan?
Yeah, no, I know. I think that covers. I mean, we're just, again, just playing that role and knowing that pelvic floor PT or OT is research we know shows that we can help with the dyspareunia and vulvodynia. We definitely have a primary role in helping somebody through this. And then, yeah, just your care team, remembering that your care team with this would be like dermatology or gynecology for medical treatment, pelvic floor PT or OT for pain and function, and then maybe mental health or sex therapy as needed, depending on, how you're doing with everything. And then just kind of like a few take-home things on it, get a formal diagnosis and start guideline-based steroid treatment if this is something that, you're talking with your provider about and you're unsure, but like getting that diagnosis, starting the gold standard of the steroids, add pelvic floor therapists in for pain, function, quality of life, and then commit to annual like specialty follow-ups and self-checks, like Roxy and I said. And again, this is something that we see. It's something that's manageable. I'd love if it's talked about more because it doesn't feel as scary. Because when you look stuff up about this, it's like, I mean, I have people come in all the time and they've looked it up and they're like, am I really going to lose my labias? And I'm like, it does not mean that that's going to happen. Could it if you ignore it? Yeah. But if we stay on top of this, it does not mean that. And education is queen, man. Like if we're just educated well, it helps empower you to be able to know and then not feel like guilt or shame over any of this. Like this is not caused by you. So you didn't cause lichen sclerosus. You don't have to live with pain or fear. With the right medical plan and pelvic health support, you can reclaim comfort and intimacy and confidence. So if you're in Kansas, both Roxy's team at Good Life Pelvic Health and my team at Kansas Pelvic Health, we both collaborate directly with, your providers to build a good, like evidence-based, gentle, like care plan. And just know that we are here to help. So Roxy, anything else on that?
Yeah, actually, usually I don't have something, but I just was thinking about this this is really something that I want to empower people. I just want people to know, like, to be your best advocate and not wait for someone to catch things. And this goes with anything, I think, of just, if you have a gut feeling or if you're just not sure, don't hesitate to just ask someone to look at the area. Like, this just looks different. And like I said, this goes with anything, but I don't know. I think lately that's been kind of my little soapbox of just, I've had a lot of patients have really good intuition on just different things, and Megan and I see this sometimes and just like a fear of asking or being, like thinking that someone's going to think you're overreacting or, whatever that fear is. And so that's basically my biggest kind of last thoughts about this as we're talking about it is to hold space for this, to know it's not going to just happen to everybody. But also, if you have a gut feeling, whether it's this or anything else in your life or your health or your world, is just to speak up and be okay and know that no one else knows what you're feeling or what you're seeing or who you are and what's going on with you better than you do. I think that can really open up a lot of opportunity then to ask good questions and just pursue and then be able to sleep good at night.
Yep. Remember, we are, like, as a person, you are the expert of your body. And if something feels off, push and go for it. And if it turns out everything's fine, but you're the expert in your body and you know what it feels like inside. You know what it feels like for things to feel good and you know what it feels like for things to feel off. So just remember that. So thank you for listening to the Pelvis Project. Let's keep the conversation going and empower more people to get the care that they deserve.
See.
Till next time.
See you later.
Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.